ऑडिओवर आपल्याला कळतं फोन आहे फोन नाही आपला आवाज त्यांना जाते कसं इट्स ऑलरेडी स्टार्टेड ओके गुड मॉर्निंग एवरीबडी I feel you are all okay in the program, right? Actually, this is my first online lecture. So today we are going to cover the topic of medical emergency in dental practice, right? Okay. Then by definition, what is an emergency? It is an unforeseen combination of circumstances or the resulting state that call for immediate action, right? So why medical emergencies are important for us, right? First thing, by name itself, emergency means it occurs in an emergency, right? So we have very less time to diagnose the things and to react. Now we have not only diagnosed, we have to react also, right? So it does not allow time for orderly information gathering, formulation of a narrow differential diagnosis before the initiation of the therapy. The time we get is very less between the occurrence of the signs and symptoms of emergency, its diagnosis, and its actual treatment. So we should always focus on the medical emergencies. That is why it is important for us to know the emergency, because though they occur very rarely, but uh, they are always they may turn up into a life-threatening complication. So we should be very acclimatized, or we should very much gain knowledge about all these medical emergencies. Okay, right? As an of in dentistry, we have very less medical emergencies. So, but we should be able to diagnose those emergencies and treat those emergencies as required. Okay. So whenever there is a medical emergency occurs, what should be our approach? Right? हे चालू आहे ना इकडं माने. So what should be our approach to the medical emergency, right? First, our approach should be the prevention, and then is a preparation, right? From prevention point of view, we should have a comprehensive medical history. Like we should ask the patient about any previous history of any drug allergy or any medical problem the patient is having, like diabetes mellitus, hypertension, angina, any cardiac, any respiratory, any psychological. Psychological means in dentistry, actually dental phobia is among the first 5 phobias in the world, right? So a lot of patients they are having dental phobia, and that dental phobia maximum time leads to the complications or the emergencies in our dentistry. So we should assess a patient's fear about dental treatment. Hello? Light गेली म्हणून डिस्कनेक्ट झालं कसं करायचं आता आपण?
power disconnect.
ओके स्क्रीन शेअर होतं सर. हॅलो कसं काय आवाजच येत नाही ना? Okay, so so it is important to get the medical history of the patient. We should also assess the patient's psychological status of the patient, especially about the fear of the dental treatment. How to prevent is we should be very observant. We should be keenly observe the patient. What we see generally is you give the local anesthesia to the patient, and you go to break the instruments, or and even this is happen in institute. While in private clinic, a lot of time patients local anesthesia is given, and the doctor they are on mobile or they are on social media. And they miss the very initial sign and symptoms of medical emergency. So if we catch up those medical emergencies at a very earlier time, so we can prevent its complication, or we can prevent it getting into more serious conditions. So to prevent the medical emergencies, we should have very observant, we should be vigilant observation, prompt recognition of symptoms of an emergency symptom. And second is by preparation, right? So how to prepare for medical emergencies, right? Uh, in though in our India we don't do those mock trials, but in a lot of institutes and lot of clinics, private clinic and institution abroad, they go on mock emergency type situation where they create a mock emergency. They see check whether drugs are available, how the protocols they are followed. So I feel clearly from clinical point of view, we should be prepared for those medical emergencies. Like we should mock drill, we should do the mock drill about emergency, like the patient has sudden becoming unconscious. So how to recognize what kind of unconsciousness it is, what may be the probable pathology behind that unconsciousness, and we should treat those unconsciousness. And basic life support is being a medical person, we should be very well versed with the basic life support, right? I will cover that. So these are all basic life support. Okay. So whenever there is a medical emergency, there are these medical basic. First is you assess the danger. You ask for help. Right. You can shout for help, or you can call your assistant, or you can call your medical colleague, or you can call the 108, that is emergency medical services. That should be the first thing. Previously it was A, B, C, D, but now first is help, right? This is now changed. Previously, when I used to study, it was whenever the basic life support, they used to tell us the A, B, C, D is the steps. But nowadays, first is help. You should first always ask for help. Okay, right? Secondly, check for any response of the patient. Okay, you can check and show, are you okay? Are you okay? You can literally check the patient so that you can judge whether patient is completely unconscious or semi-conscious, or there are some responses from the patient. And then these are the ABC: A for airway, B for breathing, C for circulation. How to maintain the airway? There are few things like first of all, patient should be placed in a supine position. Supine means horizontal position, complete horizontal position, face up, right? And you should suck out whatever the things they are present in the patient's mouth with the suction, with the help of suction. Like when patient become unconscious, there may be some saliva, or what happens sometimes because of medical emergencies, patient may vomit. So that vomit can be stay in the patient's throat, which further blocks the patient's airway, right? So you should put your thumb in the, or you should put your finger in the patient's mouth. Okay, that is called as finger sweep. You should try to remove whatever the things they are in the patient's mouth. Simultaneously, you can do the suction of the oral cavity and the patient's throat, so that it is not going to choke the patient's airway. Right? This is all to check the patency of the airway. Okay, right? And again, you can you should what you can do is a head tilt method, that is called. You can gently you can tilt the patient's head upward, uh, so that the tongue will not fall back on the oropharynx and the airways maintain. These are few things for to maintain the airway. Then the breathing, right? You can do mouth to mouth breathing or mouth to nose breathing. There are, it's all protocol there. You can go through the books, right? Then check for B for breathing. Then C for circulation. Check for the pulse. Most commonly seen pulse is a carotid pulse. It has to be seen between this Adam's circle and the sternocleidomastoid. In between this, you can check for the patient's pulses. That is carotid, right? Then these are the emergency drugs which are available. Okay, this is as per the Indian American Dental Association of India. Okay, so these are few emergency drugs. First is oxygen, which is a E-type cylinder oxygen is must in the any dental clinic or dental setup, right? And epinephrine, nitroglycerin, this is sublingual tablet used for the cardiac problem. Histamine blockers like Avil and all the things, they are used for the any allergic reaction. Bronchodilator like the asthma inhaler, they are used for the respiratory problems. Aspirin again, it is for a cardiac problem. Then other drug like glucagon, which is used for the hypoglycemia, atropine, and corticosteroid. These are all emergency drugs. You should have different setup, or you should have a special kit for that emergency drug. You should check for expiry of those drugs at a regular interval, which is very important because in dental practice or in dental we see emergencies. Those who actually require drug even, they are very rarely occur. So what happens? A lot of time the drug they become expired. Like the few drugs, they have expiry of only 6 months. It is very important to check the expiry of all these things. See, right? Now these are the common dental emergencies, right? Out of the syncope is the most common dental emergency. So I am practicing last since last 20 years. To be frankly speaking, other than syncope, I have rarely seen any other emergency. Like forget about trauma, but you can call the seizure or asthmatic attack or chest pain, blood toxicity. I have seen these emergencies very rarely in my own dental practice. Right? Even you in our department, you can see syncope is the most common uh, medical emergency in our clinic also, right? But apart from syncope, seizure is also a emergency which you can see sometimes. Trauma, yes, asthmatic attack, but the chest pain or the blood toxicity or the airway obstruction, allergy, hypoglycemia, these are all emergency we see very rarely. But though they are very rare, we should know everything about all these emergencies because as you know, one emergency it can spoil your whole career. Okay, one bad patient can spoil your whole career. There are cases that a single case goes wrong in a dental clinic, and the dentist has to quit the practice also. Okay, so you should be able to manage the emergency, and you should be able to treat the emergency. So this is all about clinical point of view. If you go for theory and all the things, it is given in the book. You can go through that. I am here to tell you most about the what is the clinical practice, what are the clinical tips I can give you. Right? Okay. So first is a syncope. By definition, this is the definition. It is a transient loss of consciousness in the muscle skin, characterized by fast onset, short duration, spontaneous. See, what is definition? It is a transient or short loss of consciousness. It's transient. It is not something which is permanent. Okay. And how it is characterized by its onset is very fast. The moment you give the local anesthesia, you go and bring the instrument, patient is gone. Right? It is very fast in onset. It's short in duration and spontaneous recovery. Why it is shorter in duration and spontaneous recovery? The moment consciousness is lost, patient slowly fall down. The moment the patient fall down, and the moment patient's head come at a level of heart, automatically blood supply to the brain increases, right? And the patients get recovered. Right? This is simple. Okay. So by definition, short loss of consciousness characterized by fast onset, short duration, spontaneous recovery. Okay. These are the few causes for the syncope. You can go through the books. You can see all these things like hypoxia or these are the lot of causes are there, right? But the most common is vasovagal cause or the common friend we call it. This is all because of fear, basically, right? In our setup, in our dental, this is for the medical point of view. But if you see from a dental point of view, if I ask from the dental point of view or a clinical point of view, the most common cause of syncope in our setup is fear. Okay? The patient it has a lot of fear for the dental treatment. So generally you see that is because of this fear only you see syncope is more common in a patient of age group of around 16 to 34. Okay, you see because what happened because of the feeling of adultness or because of the feeling of being a mature or a macho man, right? So they hide their fear. What happens to patient? They hide their fear. They don't show their fear. Actually, they have fear for dental treatment. If they when sit in the dental chair, they hide their fear. But because of this, they there is a no muscle activity, right? Because of no muscle activity, whatever the blood, in case of emergency, blood is pulled towards the periphery, and there is less blood return to the heart. Because of less blood is returned to the heart, less blood is given to the brain. Because of that, because of less blood given to the brain, patient go in a transient loss of consciousness, right? So become patient transiently become unconscious. Okay, And this is the same reason why the young children, like the children, they don't hide their fear. They are not like adult, right? Okay, so they don't hide their fear. If they are fearful, they will cry, they will throw their hands and everything, right? But they never try to hide their fear. So that is why syncope is very less in the children. Okay? Again, syncope is comparatively less in the older people, the people more than age of 40 years. So whenever if a young children or a patient which is above age of 40, they become unconscious, it has to be treated very seriously because in those cases, which is the most common cause for syncope dentistry is fear of the psychological. So these causes are very less likely in a young adult or a young children, sorry, or the adult more than age of 40. So if a child of age less than say 10 years, an adult more than age of 40 years, they become unconscious or they will syncope, then it has to be treated very aggressively. You should always suspect something beyond fear in those type of cases, right? But a middle age group, like the around 16 to 35 years age group, patient is the male patient, the macho man or the feeling of a heavy person. So you should always suspect the fear is to be the main factor for the dental pain, right? Clinical symptoms of the fear, they goes in a pre-syncope, syncope and post-syncope. Depends upon what stages it is in. Pre-syncope early, that is what we can see is hand and feet, the extremities, cold extremity, okay, hypotension, tachycardia, patient is breathing very heavily. These are all the symptoms of the pre-syncope. That is how you can recognize. That is why I told you, whenever you give anesthesia, you should be very vigilant. Okay? Maximum time syncope occurs at the time of doing local anesthesia or at the time of extraction of the blood. Okay? So you should be very vigilant during all these things. Right? And then while the syncope, again, there is bradycardia, pulse become very weak. If you check for the brachial pulse, arterial pulse, then it is very pulse is very low, it's weak, ready pulse. Um, if you don't treat the patient at the right time, then patient may do any permanent loss of consciousness. So, loss of consciousness may be this patient may be more dangerous. These are all post syncope, right? Like the color, nausea, weakness. It can last up to 24 hours. By book, by very post syncope symptoms, they can last for 24 hours. Management, there are a lot of management, but just basic management. Because first is a position, right? In position, if you are doing a sitting dentistry, first is make the patient supine so that the brain and the heart they come at the same level, like slightly elevated, so around 10 to 15 minutes. This is most important whenever the patient goes in syncope. So first and foremost is a position, right? Then second, after the position, second is if the patient doesn't recover, we can we can check for ABC, what I said. That is airway, breathing, and circulation. If everything is normal, then check for vital signs like what I said, pulse and deep blood perfusion. Okay. And here this is administer aromatic ammonia, like the some strong smell. The patient can get awake spontaneously. In my setup, in my clinic, what I do, we have handy, very handy three-way syringes. Okay? So if you press both the button of three-way syringe, the water and the air, it comes simultaneously. It's like a spray of water, not a steam of water, stream of water. So that sudden spray of water, a sudden jerk of water on the patient face, the patient may get out of symptom. What in my setup I use. In my setup, what I tell my what I told my patient to continuously do the movements of the leg. Okay, right? Because calf muscles they are called peripheral. Don't matter. But the calf muscles they are called peripheral. Right? So because of the movement of the calf muscle, the return from the our lower extremity is increased to the heart. Okay. Once the return to heart is increased, output is also increased, and the more blood is supplied to the brain, and the recovery of the patient is faster. Then few more clinical tips is like ask the patient to take a deep breath. What happened with the deep breath? Again, the peripheral circulation of the venous return to the vena cava is increased to the heart. As the return is increased to the heart, more blood is pumped out by the heart, and the patient's brain get more blood and more oxygen. Right. One more thing in the position I just want to tell you about the supine position is applicable for all the patients except pregnant women. Okay, especially the third trimester of the pregnancy. There you cannot give the supine position to the patient. But what happens because of the pressure of the baby of the fetus and the uterus, the inferior vena cava is blocked, so the venous return to the heart is induced. So especially for the pregnant female, the position has to be the right lateral. Okay? Patient should be on the right lateral position rather than a straight supine position. Okay. Then the definitive management it comes the administration of atropine, right? 0.5 mg per ml that is the dose. And if even after doing all these things, the patient did not recover, then you should definitely seek for the medical assistance. Okay. Then next common complication is seizure. Okay, this is related to central nervous system. Okay, again by definition, this is related to the cerebral function, characterized by an attack involving change in the state of consciousness, motor activity, sense of memory. Again, it is usually sudden in onset and the it is of brief duration. Okay, these are all classification of this seizure. Which the medicine people they will put all these things. Okay. There are definitely some triggering factor for the seizure, right? Generally, all the patients who are having epilepsy, or this is called seizure or epilepsy, they are on a medications, right? They are called anti-epileptic drug. Okay? So most common reason for seizure trigger is missed medication. So patient, generally these patients they are neglected patients. So they may miss the anti-epileptic drug. So that can cause the sudden occurrence of the seizure. Then hormonal changes, especially in the female, it is related with the menstruation cycle. Okay. Then a few people they are photosensitive. Okay. The sudden or the smell, strong smell, or the light, or the strong sound. There are a lot of things that they can trigger the patient's seizure. Okay. In our dental practice, that can be the stress or the anxiety that can especially for our point of view, from dental point of view, two things I feel more important. They are first the missed medication, that is they don't take their anti-epileptic drug. The stress or the anxiety related to the dental practice, right? These are the two main reasons for the seizure. Then, these are the common symptoms of seizure. These are given like shaking, or you can call it as a tonic-clonic contraction of the tongue, suddenly blank face of the patient, confused speeches. These are all symptoms of seizure. Again, what I told you, prevention is very important for the any medical emergency. You should try to prevent those medical emergencies, right? So, what prevention we can do in our practice or clinic? See the patient. Maximum time the patients they are non-epileptic. So whenever we go to consultation or when we go to take the case history, we plan for the treatment. Then you should ask the patient. You should make it sure that the patient has taken their regular dose of anticonvulsant on the day of treatment. That is very important. But what I told you, what happened maximum time patient they miss the drug, the chances of seizure is there. Okay, right? Second is these chronic epileptic patients. They generally know when is the impending seizure attack, right? They themselves feel that now I am going to get a seizure. Okay, so you instruct those patients, you alert those patients that as the aura of impending seizure manifests itself, they should tell all these things to us so that we can stop that activity and we can do the corrective measure for that seizure. And again, they keep the life support equipment, which is as usual. Right? Then management, right? Okay, management is simple. First, it is a self-limiting emergency. Maximum time the Caesar attack can go. Right? So what is important is again position, supine position on a flat surface. It's very important. Okay. Remove any dangerous object from the mouth, like you are doing some procedures, orators, the sharp elevators, or your knife, as you are in oral surgery. So you should your needle, you should remove all those instruments immediately because they are uncontrollable. So you can inadvertently injure the patient. Using the tight clothing, okay, and avoid restraining the patient. Because it is self-limiting. You should only just protect the patient, not restrain the patient. Okay? Maximum time seizure attack it stops immediately. But if it doesn't stop, then yes, you should do the diazepam. Dose for diazepam is 10 milligram IV. Repeat every after 10 minutes. If you know what it is. If it is a status epilepticus, you should definitely shift the patient to the medical setup where there is ICU. Okay. And next is hypoglycemia. Okay. We'll take this and in next session we'll go for drug related emergency. Okay. Right. So next is hypoglycemia. Next medical emergency. Now there are a lot of diabetes mellitus patient with diabetes. Okay. Right. So what happened? Diabetic patients they take their diabetic drug that is whatever the oral hypoglycemic agents they are using. Okay, and they skip the meal. Okay, so what happened? They skip the meal, but they take the oral hypoglycemic agent. So that leads to the low blood sugar level in diabetic patient. Or patient is on diet or patient is on hunger, right? A lot of the patients skip the meal. These all things they lead to the uh, low glucose level. Okay, so these are the sign symptoms for low blood sugar. Like I don't know if you have some diabetic patient in your family. Whenever the sugar level goes very less, the patient complains of symptoms like sweating. That is most common symptom. Or the tremors they are feeling, especially weakness, sleepiness, headache. These are all sign symptoms for the blood vision, hypoglycemia. Okay, right? So whether in your clinic, in your practice, patients of diabetes mellitus, diabetes comes to your clinic, and he becomes suddenly unconscious. You should always first suspect for hypoglycemia, not hyperglycemia. Okay, right? So hypoglycemia is the first chances that the diabetic patient, after giving it's like after doing the paralysis or after doing instruction, if you become unconscious, then you should always suspect for first hypoglycemia, not hyperglycemia. Okay, and the management is first glucose and sugar containing beverages. Uh,
तो वाच है 7 वर्ष
hello,
इकडे येऊन पिता
hello. So the management of hypoglycemia, okay, is in three things. The patient is माने माने माने
झालं का सर?
नाही ना, झालं नाही.
आहे ना सर.
चालू आहे? चालू आहे सध्या. की मला वाटलं की ते बंद झालं नाही.
हे ऑटोमॅटिक स्क्रीन बंद होतं.
ओके ओके, फक्त स्क्रीन असं आहे का? ओके. Sorry for the disturbance. We are here with the management of our hypoglycemia, right? Okay. Management. If the patient is conscious, then patient should be administered, or the patient should be given sugar-containing beverages or the foods, like the milk or the candy bar or the fruits. Okay, right? Patient is not able to take orally, then IV dextrose has to be given. Initial bolus of 20 to 50 ml, 50% dextrose should be given immediately, right? And if patient is unconscious, then you can give the glucagon, that is 1 milligram intramuscular subcutaneous. What is glucagon? How the glucagon acts? Glucagon it helps in the release of glucogen from the liver. Dosage is what I said, 1 milligram intramuscular, right? Okay, okay, right. Um, this is we are here. Okay, we'll finish up with the trauma, and the next part we'll go with the remaining medical emergency, right? Trauma is the most common dental emergencies. Commonly, right? Most of all common facial injuries, dental injuries are the most common. Most common injuries are the fracture of the teeth or the luxation of the teeth, especially the upright. Okay, and traumatic injury to the maxillofacial system, like the fracture of the
एवढंच
jaw.
आहे पुस्तक. आता जास्त शिवू नका ना. ती जेवढे 4-5 आत्ता येते तेवढे ठीक. पुन्हा वजन कमी करून जसे हे ब्लाऊज तसे.
Okay, management of the dental patient. Our patients using before, as usual, airway, chin lift, jaw thrust, manually move the tongue forward and maintain cervical mobilization. Again, AB, travel control of the bleeding, that is maxillofacial bleeding, dilation, nasal bleeding, first aid, and the, if patient is referred to the higher center or the oral surgeon for the definitive management. Okay, right? The next series will go from the cardiac and the interventions.
It's like I chalo तू ये दोन वाईट दिसणार बघून येते का तर काय आता मला ठेवायचं